Hey y'all, it's Dr. Ali from the Performance Place, and today's video is going to be about ankle impingement. The purpose of this video is for instructional purposes only. If you feel like you may have this symptom or this condition, please make sure you consult with your physician and get their professional opinion. So let's go ahead and start talking about what exactly is ankle impingement syndrome, like what are the symptoms that people generally are feeling. You're going to have this sharp shooting pain either in the front of the ankle. It's almost going to feel like a pinch every time you're trying to dorsiflex your ankle. It can be found in particularly communities of runners, weightlifters, anything that's going to require you to do a toe-off action. So let's go over the general anatomy of the ankle and what we're looking at. It's composed of three different joints. You've got the talocrural, you've got the subtalar, and then you've got the inferior tibiofibular. So what's unique about the ankle is it's completely covered in articular cartilage. So if you injure it bad enough, it's going to be tough to actually repair and heal it. If you do pull off enough cartilage where you end up on the subchondral layer, that's the only part where you're going to have vascular supply. The tricky part about subchondral layer, though, is when you're trying to heal it, it's not going to replace it with the articular cartilage that you've damaged. It's going to replace it with fibrocartilage, which is more of like a fibrous type of material. It's not really functional. So when you're trying to go back out there and do any type of plyometric exercise or burst type of movement, you're not really going to have the quick biomechanics that you generally would, nor would it be as comfortable with the smoothness that's generally there with cartilage. It's going to be more of like a pinching type of feeling. The other thing about the ankle is that it's completely stabilized by ligaments on all sides of it. It's actually got 4 major ligaments, and the unique part about a ligament, and I brought this rubber band here to show you, is when you stretch on a ligament, it bounces right back. So this rubber band actually shows that very well. But as most girls know, if you use this as a hair tie and you stretch and stretch and stretch, which is just like if you did a sprain of your ankle, this rubber band will eventually stretch out so much and it won't go back to the original size. So you see how that stretched out so much. And is it difficult to get this to go back to its original size? You can absolutely do a lot of rehab to strengthen the muscles in the surrounding area, but as you know, ligaments attach bone to bone, and it's more of tendons that attach muscle to bone. So these don't generally ever shrink back in size, but you can actually strengthen the surrounding muscle and make sure that it's strong and stable. So I want to really focus on the biomechanics of the body when we're talking about anatomy. The ankle is a joint of mobility, and when you're assessing the body, you start from the foot and you work your way up. So when you have a mobile joint, which is now stable because it's been filled with scar tissue from a previous injury, you're not moving in the proper biomechanics that you generally would. So when you're trying to look for that ankle dorsiflexion, whether it be you doing a squat or trying to toe off on a run, you're going to have some discomfort with it, and that's going to prevent you from being able to go through your full range of motion. So now your next biggest question is going to be, how do I know that I have ankle impingement syndrome? Because the symptoms are so similar to a really extreme ankle sprain, or it could even just be really low posterior shin splints, which has that same sharp feeling. The best way to actually fully diagnose a soft tissue condition is going to be with some sort of imaging. A lot of people choose to do an arthroscope with the ankle. You can also do a musculoskeletal ultrasound and an MRI. Options for treating ankle impingement syndrome is going to be something more along the lines of first assessing whether or not it's a functional stability issue or a mobility issue. When we're looking at the body, we want to assess all the major joints, and we're going to start down at the foot and work our way up. When you're looking at the ankle is a joint of mobility. It should be the one that's doing all the motion and allowing you to have the kinetic flow throughout the rest of the body. So if you've at some time sprained your ankle and you've had all this swelling, you've put ice on it to reduce the swelling, get you out of some pain, your body put in some scar tissue there to develop some sort of stability because of the rapid motion that you did to have the sprain to begin with. So we have to get rid of that scar tissue and bring back the mobility into the ankle. You probably at some point also had some knee pain because you didn't address the fact that your mobility had decreased in the ankle. So now you've got these really wobbly knees that are trying to take on the role of the ankle and the knee at the same time. I hope you found this video helpful. If this is something that you feel like you have, remember you can go and talk to your doctor about it. Please feel free to give us a call or visit our website at p2sportscare.com, and we'd love to hear any feedback you have on our videos, and please remember to like and share if you want to see more. Thanks and have a great day.